Hello everyone. In this video, we are going to talk about a very important infectious disease of the gastrointestinal tract system mainly, but it is a systemic disease. And we know it with a very famous name of the enteric fever. So let's talk about the enteric fever. How we define the enteric fever as a disease. The definition is an acute systemic illness which is characterized by the fever, headache, and the abdominal discomfort. When we talk about the geographic distribution of the typhoid fever in the world, then we see that the majority of the cases they are localized to either subcontinent, especially the India and Pakistan, and also to the Africa, especially the Central African states, and also the South America like the Brazil and Argentina. So these are the main focal area where we see the majority of the deaths and majority of the cases of the typhoid fever. Talking about some general facts about the enteric fever, let's first classify the enteric fever. It is classified into the two categories. One is the typhoid fever and one is the paratyphoid fever. And what are the causative organism in each of these? Typhoid fever is caused by the Salmonella typhi and paratyphoid fever is caused by the Salmonella paratyphi. Humans are the only host which are available to the organism, and its transmission is through the contaminated food and contaminated food and water. Once they have spread the organism to the other person, then the incubation period is between the 10 to 14 days, and during these incubation period days, the organisms goes through the body through certain changes, and it brings about certain changes within the body, which we are going to talk about in pathogenesis. Now let's briefly talk about the pathogenesis of the enteric fever, how a patient catches the enteric fever, and what is the process through which the organisms attack the body of the person. Now take example of this person who is drinking the contaminated water. This water is containing these red areas, red dots, which are the Salmonella typhi. And now this person actually ingests this water which contains the Salmonella typhi, and after going through the esophagus and the stomach, it ultimately enters into the small gut, which has got three parts, which first one is the duodenum, second is the jejunum, and the last one is the ileum. So the first thing is that once we ingest either the contaminated water or the contaminated food which has got these Salmonella typhi, these ultimately reach into the small intestine of the patient. From the small intestine, these microorganisms are these Salmonella typhi and Salmonella paratyphi, especially the Salmonella typhi, because they are the major one, or in the majority of the cases, these are incriminated the one. So they continue their journey from the small intestine. In the small intestine, these red dots which represent the Salmonella, they enter into the pear patches. Pear patches develop which contain the microorganism, and from these pear patches, these microorganisms enter into the regional lymph nodes, and from the regional lymph nodes, from these regional lymph nodes which are located there, these microorganisms ultimately enter into the blood vessels. Now once in the blood vessels, these Salmonella typhi or paratyphi, they starts creating the sign and symptoms in the patients, because once now they are open and free into the circulation of the patients. So this is how the Salmonella enters into the body, then gain access into the small intestine, into the pear patches, then into the regional lymph nodes, and ultimately enters into the circulation to cause the sign and symptoms of the enteric fever. The clinical features or clinical presentation of the patient of the enteric fever is broadly categorized into the symptoms with which the patients come to the hospital and signs with doctors on the physical examination finds or elicits in the patients. So what are the typical symptoms with which the patients presents to the hospital emergency department or OPD? These are the intermittent fever, headache and abdominal pain or discomfort. And what are those findings which a doctor elicits in a patient during the physical examination? These are abdominal tenderness and enlargement of the liver, enlargement of the spleen, which is though very difficult to find out, but one can find out. There may be the enlargement of some of the lymph node, which we call the lymphadenopathy. There are certain very characteristics and very few scanty maculopapular rashes on the trunk or the body of the patient, which we call the rose spots. So, what are the ways to diagnose a case of the enteric fever? If patient has come with a clinical picture, a very specific sign and the symptoms, and it points towards the possibility of the enteric fever, then what are those tests which we should obtain in the patients? Ideally, we do get CBC in all of the patients, and they are leukopenic, but this is a very non-specific finding, which may be in all others most viral illnesses. Withdrawal test, which was so oftenly done in the past, has got no significance nowadays. It's an antigenic test, but it's not very significant nowadays. So better we do not perform it. One of the important tests is the blood culture for the detection of the Salmonella typhi, and this is positive in the first 2 weeks. We can also get stool and the urine culture, but in majority of the cases, stool and the urine culture, they are done to identify the carriers of the enteric fever. Bone marrow culture is one of the most important tests, but it is done least number of the time because it's very painful. But bone marrow culture is most important and significant test to diagnose a case of the enteric fever. Patient has been diagnosed as a case of the enteric fever. How we are going to treat the patient? The drug of the choice nowadays is the ciprofloxacin, which is a quinolone, and we can give it as a dose of 500 milligram twice a day. And the duration of the treatment depends upon the condition of the patient, and the longer we treat the patient, the lesser are the chances that the patient will turn into the carrier state. If patient is allergic to quinolones, or if especially if there is resistance to the quinolones in some part of the world, especially the subcontinent and the Africa, people are resistant to ciprofloxacin, then we have two options. One is the azithromycin, which is a macrolide. We can give 500 milligram per orum stat, and then 250 milligram once a day. Then the number of the days depend how severe is the problem. That can go along roughly 7 to 14 days. And second choice is that we can also use the third generation cephalosporin, which is ceftriaxone. Injection ceftriaxone 2 gram intravenous twice a day. And again, the duration depends upon the severity and the choice of the doctor. So these are the three best options which we have to treat the enteric fever. What if the patient is either not treated properly or is not treated at all? Then the mortality in the Asia and Africa, it goes higher than the 30%. But in case of the developed world, especially the United States of America, the mortality of partially or untreated cases of the enteric fever is 1 to 2%. And the same goes with the complication. Complication rates are higher in the underdeveloped world as compared to the developed world. And these complications of the untreated or partially treated enteric fever are namely meningitis, lobar pneumonia, osteomyelitis, intestinal perforation, and the intestinal hemorrhages. Now, there is another very important factor we need to talk about, that is the carriers of the Salmonella. Now, these are the ones who are carrying the organism in their body. There are two categories. One is the convalescent carriers and other is the chronic carriers. The convalescent carriers are the ones who have been successfully treated for the infection of the enteric fever, but still they keep on excreting the Salmonella in their excretions for several months. We call them convalescent carriers, the one who have been successfully treated. Now, there are another group of the carriers which we call the chronic carriers. These are the ones who continue to harbor or the organisms remains in their body for more than a year. Now, there are two very famous places where these organisms lives in them. Majority of the cases are the one where the gallbladder is holding the organism, and these cases do develop the gallstones as well. But in the Africa and in the Middle East, there is a schistosomiasis which has got a urinary access in the patients, and urinary bladder holds the organism of the Salmonella typhi in these patients. So these are known as the chronic carriers. So these are two categories of the carriers of the Salmonella. So how to prevent the enteric fever? One is to improve the sanitation. Secondly, to use the clean water and avoid drinking the untreated water. And there are you can also use the typhoid vaccine, which is either inactivated or live attenuated. Now the mortality in the world is 17 million. So the majority of these cases are in the underdeveloped world because of the uh, non-sanitation of the water and contaminated food and beverages which are causing these problems. So in order to prevent them, you will have to avoid these kind of waters.